a clinical geriatric pharmacist and educator. Dr. Hajar serves as professor and director of population health pharmacy program at Jefferson College of Pharmacy. She also received her PharmD at I gotta butcher this name, Duquesne University, and completed her fellowship in geriatric pharmacology at the University of Minnesota. So with that, let me turn it over. I believe Dr. Worcester is going first, if I'm not mistaken. But we will have a Q&A a little bit later in the presentation. We want to start off by providing some basics of medical cannabis 101, talking about the risks and benefits of utilizing medical cannabis, and then open it up to questions for those of you who are in attendance. But thank you very much.
Thanks. Happy to be here. I think Greg and I are going to kick things off, and then we will turn it over to my colleague, Dr. Hajar, for some of this in terms of how it interacts in an aging population. So what is cannabis, and why do some people call it cannabis and some people marijuana and some people hemp? I think that's an important place to start. Cannabis is kind of the genus and species, if you say Cannabis indica or Cannabis sativa, of the plant itself. So that's kind of the scientific name of it. Marijuana is defined basically by the federal government. Federal law defines any cannabis plant that has more than a certain percentage, and you can see right here, of the delta 9 THC, or the part of the plant that gets you high, quote unquote, calls it marijuana. It is exactly the same thing as hemp, except hemp has less than 0.3% of that same substance. And that was sort of a federal law that drew a line in the sand there. But in reality, guys, just so you know, we're talking about the same thing, the same plant. It just has a different kind of makeup, if that makes sense. The two other parts to know about the cannabis plant, there are thousands of what we call phytocannabinoids, or plant-based kind of molecules or chemicals found in the plant. The two that you hear the most about are THC, right? That's the primary intoxicating one, or the one that gets you high, and CBD, and that is primarily non-intoxicating. Both of them kind of respond to or work at the same receptors in your body, but the difference is about that sensation that we all sort of associate with cannabis, whether you're getting high or not. Next slide, please. Thank you. So this is what I was mentioning, that we have these receptors in our body that are called the endocannabinoid system. And these are the reason, frankly, that cannabis is such a interesting kind of medical therapeutic option, because our body makes chemicals that mirror the structure of CBD and THC. They're just less potent than kind of the amount that you get when you ingest or inhale cannabis. The receptors that are the darker kind of purpley, or purple, green color here, are what's called your CB1. And that's really where the THC kind of strongly activates. And you can see that's mostly in your brain, right? So that's why it kind of has those effects. And the CB2 receptors are a little bit more widespread in your body and also in your central nervous system. And this is where CBD more kind of strongly binds and activates it. But this is why we talk about and want to study more about why cannabis can be a helpful thing for medical benefits. Greg, you want to talk through this one?
Right, happy to, Brooke, thank you. So as you may know, cannabis in our country is this very interesting thing that is still federally illegal, yet each state is allowed to kind of figure out what it wants to do in that state. So you get this, bad word. You get this hodgepodge of different programs that often have very different rules in very different states, some of which have just medical programs like Pennsylvania, Florida, the Dakotas, and others which have what are called, you may hear recreational or adult use, kind of like you just walk into a store and you need to be 21, and some have both. The the stock advice is that if you go into a legally regulated dispensary, it is highly likely that you are going to get what it says you are getting on a package. However, with the proliferation of kind of CBD products available kind of all over the place, from gas stations to Whole Foods to CBD stores, there's a fairly low likelihood that what it says on a label is what you're getting, unless it has been certified as it's been analyzed and the products are reported on the compounds are reported on the label, and companies are using good manufacturing processes like supplements, something like that. And so, lots of questions come up that, we have had. Brooke Emily and I, since 2017, when Pennsylvania's program started, we have created and run a clinical and research program in medical cannabis, looking at kind of lots and lots of aspects of it. And among the questions that we hear are, how is this going to affect my physical health? How should I be using this? What should I use? Drug-drug interactions. How will it affect my mental health? Is this a good treatment for anxiety or depression? And differences between THC and CBD, which we can get into. For reasons of federal illegality, doing research in our country in kind of the traditional way, like you would a drug or something else, is very, very difficult, because medical cannabis is considered a Schedule I drug. So getting a permit from the federal government in order to do kind of randomized controlled trials, the way many other things go through the process, is almost impossible, which will be a wonderful thing if and when cannabis gets rescheduled, and hopefully sometime early next year. Much of the research that we do see here comes from overseas, comes from places like Australia and Israel and European countries, Scandinavian countries, South American countries, who have different, regulatory, patterns, rules, policies. So I think we're good.
Oh, so guys, we would love to have this be as interactive as possible, and honestly, please put out any questions you have. But have you ever received conflicting advice about cannabis? I wonder if any of you guys have talked about this or have gotten different either opinions or insights from friends, family members, clinicians, the internet.
And feel free to put it in the chat. I think that will be the most useful way, and then we can respond. And give some thought to how and with whom you did make a decision, or how you would make a decision about using medical cannabis. It's kind of a very interesting process. We've spoken to probably up 5,000 people so far, and it's all over the place in terms of who people talk to get guidance on cannabis.
One of the questions that we receive quite frequently from members is, how should they go about speaking with either their primary care physician or other medical care providers about cannabis? What types of questions should they be asking? And what do they do if their provider says, I'm sorry, I don't know enough about this, or I'm not comfortable with it? It really leaves members sort of feeling like they're stuck in the middle.
And you are not alone in that. We see this everywhere. And, kind of the cut to the chase ending for the question about this is that, like, doctors stink at this, right? Less than 10% of all of the patients in our national study looking at this are having or getting advice from their clinicians. And it's not that all kinds of different clinicians, nurse practitioners, physicians, pharmacists, it's not that people don't think there is a reason to use cannabis. It's that none of us were really well educated and trained to understand kind of the nuts and bolts that you guys need to know. So the vast majority of your clinicians are going to say, I don't know, in some ways, right? I think increasingly this is becoming an area where healthcare professionals are at least very open to the conversation, even if it's saying, I don't really know, but that's a possibility. And I would suggest saying, I am curious about this. Do you have any experience, or what are your thoughts? And do you have any places that you could even send me to get more information as a starting point if people kind of say no, they don't have any? Greg and Emily, I don't know if you guys have thoughts.
Often finding kind of good, reliable cannabis information is a little bit of a challenge. Often state websites for states that have medical cannabis programs can be very good. They vary a lot, but that is often a good place to start. And there are some other decent sources out there, but it's not an easy thing. There are a lot of variables, and it is something with which people have very little familiarity. And so I see a couple of questions popping up here. Indica versus sativa for sleep, or a hybrid. So that's a great question. We can definitely address that. Another person not needing it right now, but like kind of how do I educate myself, and where do I start? It's the proliferation of online and stores and dispensaries and different programs everywhere certainly doesn't make that easy.
And this is a good place to start. I mean,
Yeah.
there'll be other resources that we certainly can help provide to you guys to keep that conversation going for yourself.
And
So let's talk through these questions.
Yeah.
The indica versus sativa. Okay, so my very honest kind of thinking about this and derived from the data and what we've seen when we've been in grow facilities and kind of talked through the products with the people that are making them in state regulated dispensaries or other places are, I care so much less about the indica versus sativa, and I think you should too, because the vast majority of these products are what are being extracted and called hybrid, sort of a mishmash of these plants that have been kind of cross-pollinated, so to speak, in ways that have now made it way less like a sativa is sedating, or I mean, a sativa is kind of activating and an indica is sedating. It's not like that. That used to be sort of the nomenclature that way back when kind of everybody followed. Now it's more about like knowing what's in it, right? So the amount of THC, the amount of CBD, the amount of some of those other cannabinoids is a better place to start. Certainly some of them will be at least named or aligned with kind of what their indication is for, and some of them that are done well. So you'll see things that are more indicated for sleep or rest or relaxation versus like something that might be a little bit more activating. Some of the names are like purple haze and, elephant toenails. And so that doesn't help, but
that's just
like
marketing.
it's all marketing. Exactly. It's just to like, grab someone's attention. But some of the places and some of the products that are well done that are a little bit more medically indicated are sort of putting the components in them that and naming them as such. So like relax or sleep, or right, you'll see ones that are named that. There we talked about this. I think that the answer is, and this answers someone's question here, do insurance carriers provide coverage? And if so, what is typically required? In this country, not yet. Not in any instance that I have ever been aware of. In other countries, yes. And I think, guys, this is coming. We have been working on this diligently, and as rescheduling is coming, and I think, things like EO continue to proliferate, this will get there for you. But right now you cannot get insurance reimbursement.
If I could just quickly add to that, here in Massachusetts, our insurance providers, as well as the state, are monitoring these developments closely.
Hello.
Dr. Worcester mentioned
Out
that.
of my law.
Whoop. as Dr. Worcester mentioned, as the federal government changes the classification and some of the other laws and regulations governing cannabis, the feeling is that that will open the door for insurance providers perhaps covering this. In Canada, in certain instances, it is covered. That's one example, of a country that is providing these benefits through their insurance system. But it's just not quite there yet. But we also believe that it's coming.
All right, so I thought I would talk a little bit about cannabis and the impact on us as we age. The good news is that mostly cannabis is generally safe even as we age. But the biggest takeaway, I think, is really to use it with somebody helping you or with some guidance, okay? So as a pharmacist, we have things like medications that have a very reliable, dose and the way you take them and how frequently you take them. And that's a little bit more unknown with cannabis, although a lot of people are doing more studies to get more reliable information. And so it's really guidance and, engaging with somebody that is knowledgeable about the product that can really help make it a good use for you as you age. And then, Brooke talked about the two different components or the two major components of cannabis right now, which are THC and CBD. And we know that CBD is usually very well tolerated because it doesn't have any psychoactive effects. THC requires a little bit more help because we know that that's the one that can potentially, cause some dizziness or some sedation. And so again, you really want to make that, get some help on and how much and how often can you take those types of products. And then keep in mind too that, a lot of times people historically think about, smoking these or inhaling these products. But there's edibles and capsules and topicals, which make it use much more easy. Keep in mind that, again, there are risks with cannabis, so misuse can create problems. So if somebody uses very high doses for very long periods of time, there are risks of cannabis hyperemesis syndrome or even cannabis use disorder. And right now, both of those are, seeing about a 30% incidence. And again, with more guided use, it's not as likely to get into those categories. And then again, without guidance, it often takes people a long time with trial and error to find out what product works for them, what dose, what's safe, but what's really effective for their condition. So again, if you really do engage with, either a service or a clinician that's very knowledgeable, it can really kind of pinpoint what do you want to treat and then how do we go about that. And I want to point off at the right side of the screen, the poisoning deaths for various drugs. So, at the top of that list is prescription opioids. We use this very commonly for, painful conditions. But just want to point out the most or the least impactful is cannabis. So you'll notice the red line is right at the bottom. So poisoning deaths are very rare for this compound. Next slide. So just a couple of people were saying, what can I use cannabis for? So there's a lot of benefits as we age. I think the big one that a lot of people assume is the chronic pain relief, and that's absolutely one of the biggest indicators that we see for this compound. So both CBD and THC do have beneficial effects for pain. Specifically, CBD is really anti-inflammatory, so it can treat like common everyday arthritis or things like neuropathies. And then also pain creams that have THC or CBD in them oftentimes are much more localized for the effects, so you can minimize any systemic effects that you might see. Sleep is another big complaint that people often use or turn to cannabis to treat. And we know that as we age, sleep disturbances are pretty common. We tend to sleep lighter. We sleep, shorter periods of time. And THC does have some sedative effects. And this can help people fall asleep and sort of stay asleep for longer periods of time. And then on top of that, not only are you falling asleep, you're a little bit more calm, right? So it can help with anxiety-related conditions as well. And again, that anxiety piece does pop up with many different chronic conditions, like let's say Alzheimer's disease. There's a high incidence of anxiety with that, and just other life changes and life stressors that do happen. So anxiety and mood stabilization are sort of another big category where we see a lot of people choosing cannabis for.
And Emily, I just saw, I'm sure you saw this too, but a study that came out again, kind of with, it's so interesting, a well done study looking at cannabis for agitation associated with Alzheimer's dementia and showed a favorable outcome. So in spaces where there aren't a lot of other safe, good options, like the chronic pain space or the dementia space, you know, it's intriguing. And I think these are signs that sort of show promise.
Yeah, and I think to that point too, you know, people, had been taboo for so long, and that we've have these new things, and perhaps people were using them without telling, and now more people can get the benefit when we do more studies like that. So I agree. And on top of that, not only will it reduce anxiety and agitation with Alzheimer's disease, but there can be some neuroprotection and cognitive support, right? And so there have been some thoughts or some studies looking at, you know, potentially slowing neurodegenerative processes. So I think a lot more research has to come on that, but at least that's promising right now. There's also some bone health and osteoporosis related impact as well, and the fact that bone health can be improved. So likely you may not want to bank all your bone health on use of cannabis, but this might be something that we add to other existing medications, or having, you know, good diet with a lot of calcium and vitamin D. Also appetite stimulation. So we know that as we age, weight is actually protective. So if people start losing big pieces of weight, or, you know, a lot of weight at the end of life, it's not a great sign. And so appetite stimulation can be one of the main impacts that, you know, cannabis has. Now, that's related more to the THC component. So that's sort of, you know, when people would use it to get high, they'd get the munchies, right? This is an extension of that pharmacologic effect, right? But if we can use it in the right amount, you can potentially have that increase in appetite without getting that euphoric effect that sometimes comes with the drug. And then again, we talked about, you know, chronic pain, but really there's anti-inflammatory benefits a lot more with CBD. And then we can think about things, you know, like, you know, heart disease that has a big inflammatory component, or endocrine disorders. And then again, any type of chronic pain as well. So lots of benefits as we age with the use of cannabis.
Emily, just a couple things in the chat before I kind of move on here. Are there medical conditions like high blood pressure that prevent the use of cannabis?
That's a good question. So the one thing we talk about is that cannabis can increase your heart rate. And so I don't necessarily, unless you have wildly uncontrolled blood pressure, it doesn't have a big impact. But what it does have an impact is if you have some types of arrhythmias, like some fast arrhythmias, like atrial fibrillation. So if that's really well controlled, the use of cannabis should not be, you know, it might speed up your heart rate a little bit. However, if you do have really uncontrolled arrhythmias, we would probably caution you against the use of cannabis. And then very serious mental illnesses, like, you know, very untreated disease states like schizophrenia, or something that's, you know, vastly untreated, that's very, very serious. Cannabis does have the potential to, it can help some you know, mental health issues, but it can make other things worse. So again, if your mental health is really relatively well controlled, it's another potential option. If it's very seriously uncontrolled, then we would encourage people to stay away from cannabis. And not in this space. I know we're really talking more toward aging, but I also like to point out that in pregnancy and lactation, we really don't want anyone to utilize any cannabis products as well.
And guys, a lot of this is driven by the amount of THC specifically. So to reiterate, a lot of the products in dispensaries are geared towards getting people high. So they have a lot of THC, and without kind of the guidance to choose the right ones, that's where you get into, and we see trouble with the cardiovascular risk factors, or that kind of psychoactive effect, and causing people to really have kind of the anxiety or the agitation. So we can control it. There are ways to know how to dose people to avoid that, and it has to do with kind of getting products that are lower in THC. Some THC is good, a ton of THC not so great.
One other question. I've also heard of success for nighttime confusion and lack of sleep in those with nighttime agitation, better than antipsychotics and sedatives.
Yeah, and we know that in older adults, right, antipsychotics and sedatives are really, really high risk medications, increase the rate of, you know, cognitive impairment and falls, hip fractures, really negative outcomes. So absolutely, cannabis has been shown to have a potential benefit without going too far in forcing some of those really adverse effects in the older adult. So yes, that is definitely been seen in the literature.
Great. Okay, next slide. So I'm going to walk you a little bit through kind of the EO products and the EO platform. Since kind of we started our program a number of years ago, we've all had lots of conversations with patients, trying to make our best educated recommendations for, what to use and how much and where to start. And I think it was largely helpful, but I think it was, a little bit haphazard. The recommendations were often generic, like starting low and going slowly, which is always good advice, but like, is there more precision to be had here? Can we put some structure around this? Can we do something that looks more like the delivery of medical care? You don't go and see a doctor and say, I would take this hypertensive, or maybe if this antihypertensive or this one, I would take 10 of this or 20 of that. And like this, in an effort to kind of get this more into something that is replicable and clinically useful, we have partnered with EO to kind of bring these resources to our patients. So next slide, please. And our experience has been very interesting, is that for novice users, or we call them never ever users, or people who are fairly experienced and knowledgeable, using the EO platform has been kind of an interesting process, and the uptake has been pretty consistent across any level of user. So even though people have experience, they may still have gotten that through just some trial and error, and it just might not be optimal. It might be kind of good enough, or they're not quite where they want to be. So on the EO platform, there are a lot of educational resources, all kind of vetted, evidence-based. You can trust them. They are from published, peer-reviewed journals. Also, the opportunity to create, and we'll have some visuals of this too, a care plan where you enter in information about yourself and the conditions that you are looking to treat, and kind of what your schedule looks like a little bit, the impact on your activity, and things that you are less able to do because of a symptom, pain or nausea or insomnia, whatever they may be. And then these care plans get reviewed, and they kind of come up with a like essentially a prescription, a schedule and products that align with the evidence and what your particular needs are. Also accommodating those who do not want to use THC, who do not want to have an intoxicating substance. So it can be kind of CBD based as well. So next slide. All right. I thought we may have some screenshots of the platform, but we can certainly share those with you. Just very nice. Like we're used to kind of when we access medical care, we go to a retail pharmacy and we get a bottle that is labeled with what is in it and how to take it, when to take it. There are also instructions often accompanying that are printed out and put in the bag. And so this is kind of looking to provide that level of support and education and guidance. So it can respond to what you're saying. And then at intervals, we ask you how things are going and kind of to rate your symptoms. And when you do that, that gets incorporated into the care plan, and it may result in alterations to it, changes, increases, decreases, other products as well. So I'm going to stop talking, and we can certainly take questions.
I did see one question that someone said, you referred to providers that are consultants for prescribed use. How are they found? Guys, Emily and Greg and I have lived in this space where we created a clinic to help guide people because there was nothing, right? And it is hard to come by. And I will tell you, this is one of the reasons why we partner with EO, because this is one of those places. Now, there's other people, and you can look on your state websites for physicians that are licensed in the space or might do that. But I think especially in the aging population, that there can be benefits and risks. I don't want you guys to feel like you have to kind of just go on Google or walk into a dispensary and do this alone. This is a platform that is meant to make it kind of easy and safe and help give you the guidance, because there aren't a ton of options out there in reality, as I think some of you have experienced already as you're trying to educate yourself or step through this space.
And Dr. Worcester, could I just add that this is exactly why mass retirees chose to partner with EO. When we did our survey back late winter, early spring, in addition to the clear message from our members that there was a real interest in this topic, and that a number of members were already either utilizing medical marijuana or interested in doing so. But the part that was really compelling for us is the lack of information that's available to people. There's a lot of confusion, a lot of hesitancy, and that really created a concern with us that some of our members may be utilizing medical marijuana in a way that is not necessarily safe or effective. So in partnering together, knowing that EO is staffed by medical professionals like yourselves, providing the free care plan for members to get a sense of exactly what they should be utilizing or not to treat their condition. And as we covered earlier, the fact that at this point in time, medical marijuana products are not covered by insurance. They can also become pretty expensive, and we want to make sure that folks are getting their money's worth out of the care that they're trying to purchase. So all of those reasons together had us arrive at the decision to partner with EO, and we are very pleased with the services being provided to our members, and the fact that all of you are taking the time today to educate our members on these important things, and help folks be able to better understand what it is and what it is not that they may be able to access through medical marijuana.
Emily, I saw there was a question about kind of the different forms. I wonder if you wouldn't mind kind of talking through a little bit of what people can find and what it feels like in their body, and timing and onset and all the stuff that you are so very knowledgeable about.
Sure. So I think, the historical form is the inhalation form. And you can do that through a couple different ways. You can smoke, you could vaporize, and then there's other ways to vaporize the different oils. Smoking, we just, want to make sure that if you're using, the actual plant and smoking it, right, there could be microbes and things like that. So perhaps a vaporized oil might be a little bit safer. But just keep in mind that those are very quick on, quick off products. That's what I call them, right? So you'll see the effects within minutes, but generally maybe 2 to 3 hours, and the effects might fade. The nice thing about those, though, is that you have a reliable when the drug is working, right? So it's the easiest thing. It's sort of like all of a sudden it wasn't working and then it was, okay? So those are the inhalational products. What's becoming very popular are edible products, things like gummies, cookies, brownies, all sorts of different things. The tricky thing with edibles is that they can take up to 2 hours to work, right? And the onset may be very gradual, right? And so what we see with edible products is that when people use them without much help, is that they take a piece of it, they want to feel the effect, and 30 minutes later, they don't feel anything. Then they take some more, then they take some more. And by the time you know it, they've taken 4 times what they meant to take, and then they're pretty loopy. Okay. So edibles are very, they can be really good. We just want to make sure that you're, properly dosing them. Again, up to 2 hours to work, but they can last like 4 to 6 hours in your system. So a longer acting product. Topicals are really great for very localized issues, right? And we always say sort of the stickier the product, right? So salves or ointments, like the really sort of heavy, oily products, have really good penetration of the products. And again, that could be something as localized as your knee, or it could be something like your lower back. So those are really great kind of localized types of things. Then there are other products that are a little bit newer, so in the inhalational space, but a little bit more reliable, are things like inhalers. So there's newer ones of those coming to the market. And there's things like transdermal patches, which again, likely have a little bit of lag time before they set in, but will have a little bit longer kind of piece overall. And then just last a little bit of a sort of a a middle road one is called the tincture. Tinctures are sort of like an oil or like a liquid that you put onto your tongue. They can set in a little bit quicker than an oral. But people also may not like the taste of those. They may taste like a little, whatever sort of they're suspended in. So again, a lot of different forms, and they really do differ on when they set in and how long they last in your body. So that's a really great thing for you to ask somebody, or to make yourself aware of when you're choosing to use a product.
The question about dispensary staff, there are lots of dispensaries, how to choose a good one. Not great. They're often lovely people, but they're kind of selling you often what is they're being asked to sell or what they've personally enjoyed. And so we are really careful about kind of going in that direction. Some states have requirements that a medical professional be affiliated with dispensaries. Very often that is not the first point of contact in a dispensary unless you're seeking that out. So generally speaking, probably the least kind of good guidance out there, not throwing all the dispensary employees under the bus. There are certainly many who apply themselves are excellent, are pharmacists who are, very thoughtful and follow the evidence. And that's kind of more of an exception than a rule.
And it's not their fault, right? They're not meant to be your clinical guidance. So I don't want you to think that we think these are bad places or products. It's just not geared to help people that want it medically. I don't know, Camilla, I don't know if you have other things that you wanted to show specifically, or you want us to talk through some of the products and kind of the extent of the services beyond the care plan.
I think, Doctor, there are some questions in the chat regarding EO's products and the services that are being provided.
Yeah, I saw that. I was looking at that, and we can talk about it. I just didn't know if Camilla had something that she either wanted to share or wanted to talk through. So I'll give you an overview because I can tell you we use this. We recommend this. Emily and I recommend it when we're in clinic a lot with our patients. So think of EO like a website or a space that you could go to on your phone or your computer where you basically put in all of the information about the what and when and why and how you want to try a cannabis product. So what are you suffering from? When would you be open to THC if you are open to it, surrounding kind of other day, things that you're doing in your day? How would you want to use it if meaning like what Emily just talked through? Do you want to inhale something? Do you, and do you want to swallow something? Do you want something topical? And a little bit of an information about kind of the other medical issues you might have and other medications you're taking. You put that in, and then it kind of gives you a personalized, what Greg had referred to as a care plan, meaning kind of like a prescription. But we know with cannabis, it's not legally a prescription, right? Because it's not something that insurance is covering and you're going to a pharmacy to get. So it gives you the recommendations on a very specific product, a very specific dose, and how to take it. The EO products are products that are like a medical inhaler, like you would use if you have asthma or COPD, oral things that you can swallow, or topical things. So some of them would be that. And if actually what you're looking for or your condition or what you need requires something else, we have curated a selection of very well done kind of other products from places that you could order and have delivered to you. So kind of that specificity in terms of the way that EO does it. Now, the next step is kind of in my medical and research brain, the coolest part is it will ask you specific questions about kind of the degree of your symptoms and what you are wanting to do in your life that you can't do because of pain or anxiety or whatever. And then it helps track that for you. So it will repeat those questionnaires. And these are validated instruments that we can kind of get very good information, both individually for yourself. You'll see your own kind of dashboard, but then as a whole for us to help further the science in general. So that's sort of the other part of it after the very specific products. I hope I did a fair job talking through that. But that's kind of the way that we tell people to think about what this would be. It kind of gives you that whole soup to nuts experience. And Emily or Greg or Camilla, please correct me if I misspoke.
No, I think that that's essentially, walking into the cannabis world, you can very easily find yourself trying to boil the ocean. And that is not an easy nor cheap task to do. So the more that we can kind of confine and narrow the possibilities and target them, and then use your feedback to drive that, seems to make good rational sense. And it has, interestingly, I'm just speaking from kind of experience in our clinic here. Patients, once they kind of create a care plan and are following it, tend to be get to a point where they're adherent, where people really will continue doing this for months on end, and providing the feedback and kind of refining the plan. But which is good, because the other piece of this is that often when you go and get cannabis outside, is your healthcare team knows nothing about that unless you are sharing that with them. So if you're bringing a receipt or a label or something, but you have like an actual care plan that you can kind of show to your healthcare providers. There aren't great ways of kind of putting this in electronic health records. And it's not like a pharmacy where you go into a dispensary and what you purchase will show up in your electronic health record at your doctor's office. So, again, putting a little more structure around this. So it'll be a little bit easier to have conversations about this and to kind of incorporate into your healthcare should you choose.
And one other question that I saw come in earlier, and Emily, kind of the general guidelines in terms of dosing for people. Just if someone's walking into a dispensary or looking for something online, give them a sense of how to look at it, or what would be kind of a safe starting space.
Sure, yeah. So generally, again, the main component that tends to be the trickiest is the THC component. And you usually will see it as THC or THCA. And so what you look for there is usually, we say doses under 5 milligrams. As we age, I would even go down to like 2.5 milligrams of THC is a starting dose. Okay. And I would really, sit with it for a little bit to see how it makes you feel. Again, that urge to take more, just to like, if I increase the dose, will have more of the effect. I think you will to a perspective, but you can certainly go overboard, because we know doses above 10 milligrams of THC initially, if you are like cannabis naive, can make things worse, like create a lot of anxiety or paranoia. Your heart rate might increase where you feel really uncomfortable. So we'd say anywhere from 2.5 to 5 milligrams of THC per dose. And then again, really kind of wait till you see the product has an effect, and then to see how long it lasts in your system. So we don't really advocate for going more, than like, once a day for the first couple of days, just to see, what it really kind of feels like for you. I also wanted to mention on the platform, one thing that I think is really a cool feature is the fact that we are asking for your meds. And so we make sure that there's no real serious drug-drug interactions. And as a pharmacist, one of my pushes with medical cannabis is to make it more medicalized so that it is acceptable. It's noted in the healthcare chart. We know we can manage it better if we know that you're taking it. But when it's something that it's not shared with your providers, again, that's a little bit more risky. And so that's why, one of the nice things about the platform is that we ask for that, and that's taken into consideration before somebody, or before you even get your first product.
Guys, you have us. What other questions? There's nothing off limits here, I promise.
So Brooke, there's one that says, does smoking represent any respiratory hazard like COPD or
Oh.
cancer risk?
All right. So as a physician, I never, ever, ever feel good about telling someone to light anything on fire and inhale it into their body, because that just isn't aligned with sort of what we know to be medically safe. That being said, there hasn't been any evidence that cannabis is a carcinogen, meaning something like a tobacco product that would put you at risk for lung cancer. However, we do see changes in lung function when people repeatedly smoke cannabis. That makes me more worried about an asthma or a COPD or something like that. So I would tell you, I would very much push, and we do push people to kind of not use smoked forms. Other inhalable forms that aren't smoked are safer. Vaporizing being the one that is kind of routinely seen in dispensaries. The product that I really like that we have, that I hope, will continue to grow and have, other options for, is this medical, the metered dose inhaler. So that you get that kind of rapid onset, but you're then kind of mirroring the way that we use other inhalable medications, not something that you're inhaling a hot vapor. But if you want to do something that is inhaled, please don't smoke it. Please at least choose a vaporized product to minimize that risk more.
Somebody asked, is a medical cannabis card required to access the products offered through EO? And the answer to that is no. All of the products that, typically all the products that we are recommending to patients are derived from hemp-based THC, and so those are legal and able to be shipped to most states, and so you do not need a card. You only need a card if you live in a medical only state, and wish to go to a dispensary for a product. But outside of that, there is no real need.
And I think increasingly, we keep talking about this, but just so you guys know, the federal government is on the path to reschedule cannabis to a Schedule 3, which is similar to the way that you would think of like a Tylenol #3 or anabolic steroid. I think this is a really good thing to help access be less confusing or financially burdensome for patients, and to help us do research better. These products that, if you're going through the EO platform, they are kind of medically safe products that can get delivered to you, so that you don't have to go kind of navigate all of this into a dispensary. That's one of the things. We work in the cancer space, and so one of the things that we see a lot with patients that are more ill or have more doctor's appointments is that if they can utilize the EO platform and get it delivered to their home, it's infinitely easier sort of than having to go out to a store to get it. So it just takes kind of one of those barriers away.
And I think another big barrier that this really helps with is that first product, right? And so we have a lot of people that inappropriately got something really strong and then walked away from cannabis and said, I can't ever use it. And so because there's a lot of guidance and really making sure that it's an appropriate first step, that it really lessens that. Now, could there still be a little bit of trial and error? I think so, but a lot less when somebody's really guiding that first step.
Mila, you created some slides of the care plan. Okay, thank you so much. And so this is just an example, some screenshots of what a care plan might look like on the left there. So essentially telling you the product to take and what time of the day to take it, plus or minus. It's not, if you don't take something precisely at 9 a.m., it will not be a problem. There's the opportunity to chat and to reach out to support. Should you need, you can email, you can chat, you can call. And then as we mentioned earlier, products which you can find on the website that are connected with the care plans.
And there was a good question in Massachusetts, like, what's the advantage of getting your medical card? Great question. And it's twofold technically in the state of Massachusetts. One is that the products will be less expensive for you. So I know it's a cost to get, but if you're using products and over the long run, this will save you money. There is, and I'm sorry, I don't know what the rate in Massachusetts specifically is, but there's always a sizable tax on cannabis products, 15, 20, 25%. And if you are a medical patient accessing the products, you do not pay tax. The other thing it avails you to in Massachusetts is a broader range of products. However, it's funny when things like this got put together, they didn't do it necessarily with kind of physicians and research community and medical people and engaged in that process. And so it actually gives you access to very high potency THC products, which only in very, very, very rare cases do very high THC products align with what any of us would sort of think medically makes sense. So it's giving you access to products that probably aren't what you'd want, but nonetheless, you can get very potent. I've seen chocolate bars in Massachusetts that have 500 milligrams of THC in it. So those are the types of things that the medical license would get you, or the medical card.
Any other questions?
Greg, the only other question that comes to mind, and we get this from time to time, and I'm not sure if we've covered this or not, but just in terms of any type of adverse interaction with prescription drugs or even over-the-counter drugs, how can a retiree better protect themselves that they don't run into, an adverse reaction?
That is definitely an,
Emily, that's you.
yeah, it's all you do. You
That's
got
what I thought.
that one.
So the first thing is I would say is that, again, I mentioned this a little bit before, is that drug interactions can be managed when there are known substances. So I would encourage you, if you're using it either recreational or medically, to make that known to your healthcare team, because they can work with it. Now, by the vast majority, when we use cannabis, it bumps the level of other medicines up. So the ones that comes to my mind that I do worry and I take pause is that if somebody's on a blood thinner, like a very serious blood thinner, so drugs like Coumadin or warfarin, apixaban or Eliquis or Xarelto, some of the newer agents, we just want to make sure that it's known that you're taking it, because there could be potential increased risk of bleeding with those agents. Okay, so those are the big ones. And then if you are using cannabis alongside of anything else for anxiety, specifically like drugs like Xanax or Valium, and then opioids, right? There's just an increased risk of sedation. It's not that you can't use them together, but it's just you want to make sure that the risk of falls, sedation, just being dizzy. So there are a number to watch for. I would say the ones that are really seriously clinically important would be definitely picked up if you use the EO platform. I also want to just note too that the research on drug-drug interactions with this it's just beginning. So we know a lot of substances. We don't necessarily know the clinical impact on everything. That's why I'm saying like they're likely to be picked up, but unsure, because it also does depend on how much you're using and how frequently you're using these products. But my biggest advice is, again, utilize a service that wants to know what your medicines are if you're going to use cannabis, and then make it known to your healthcare team. So to make sure that this can be managed from a medical perspective.
So following today's webinar, we are going to work with EO. The session has been recorded. We're going to make sure that we distribute it not only to all of you who have participated today, that you can go back and use it as a reference. I know we've covered a lot of ground and there's been a lot of great material talked about. So you may want to go back and refresh your memory on some things, but it will be on the Mass Retirees website, massretirees.com. And it may also appear on EO's page that can be linked, or the link to it can be found through our website as well. Does anyone else have any questions that you'd like to ask either Dr. Worcester or Emily or Greg?
So please feel free to reach out. We respond to people kind of
Yeah.
very quickly and would much rather kind of be able to answer questions with accurate, kind of truthful information and correct it. Now, kind of having sat through this webinar, you know more than probably 95% of the country about medical cannabis. So certainly if you have questions or this stimulated something, or you walk away today and you're like, oh, I wish I asked that, don't hesitate. Please just send us an email or give us a call. Or visit the site, and we will be more than happy to give you a human-generated answer.
Mhm.
Thank you, everybody, for your time today. We appreciate it and look forward to working with you.
And I'm so
Thank you.
glad that the mass retirees is kind of understanding the need to be able to have these open conversations. So it doesn't feel taboo, or like any of you guys are doing anything that is not kind of beneficial to your health in seeking this out. Because for so long it's been, you know, one of those hush hush things. So I'm glad that we're kind of helping open up those doors.
No, thank you very much. And thank you for the three of you for taking the time this afternoon. I know how busy you are. We really appreciate it.
Pleasure.
Have a good
Yeah.
afternoon, everybody.
Thank you.
Thanks, everybody.
Take care.
Thank you.